Well, we want to welcome Marcela Ot'alora to our show. I'm so excited to speak with you again. It's been a while. We used to work more closely together.
Yes.
And it's wonderful to be with you again.
Thank you. It's great to be with you.
Well, we thought we would start by hearing a little bit from you, Marcela. For our listeners, this is a real treat because you, I think, more than almost anyone on the planet, have a huge amount of experience working with MDMA-assisted psychotherapy in clinical trials. And
Yes.
I think you've been at it for more than 20 years, I think now, right?
Yes, a little over 20 years in terms of doing the research part, yes.
Yes.
And I'm looking forward to this phase ending.
Yes. Yeah. Well, I want to thank you for carrying the flag so consistently and with so much determination and care.
Mm-hmm. Thank you. Yeah, it's been, it's had its challenges, but definitely it's sort of like seeing in the horizon the importance of doing the research and how valuable it will be to have the data together. And so I see that, I see the value of it, and that is so important. And then I also see so many wonderful things that happen within the work itself. And that's also a wonderful piece that carries us through.
Yeah. Yeah, I'm wondering if we could talk a little more about what actually happens in the room, and what the elements are that you feel can be the most healing or the most effective in what you're seeing.
Yes, sure. I think that the parts that we find are the most helpful, and this is, of course, not something that is measurable, but is the belief in the inherent drive of the human spirit to heal itself. To really believe as clinicians that exists in our participants, and that we're here to help them with that. But it is really characterized by like a quality of self-trust and of love. And so can we sort of expose that? A lot of times people with PTSD don't really know what that means and don't think they have that. But I have never, ever seen in any session that I have done, and I've done many sessions, over 200 sessions of actual MDMA in clinical trial, that it hasn't shown up. That this healing intelligence, that this drive for the spirit to really go towards healing, that it hasn't shown up. And sometimes I tell the participants that it's sort of like the DNA of a seed is that it only has this purpose to grow, and that is, as human beings, we have that purpose as well, and that theirs just got stuck, because of the trauma. And so the beauty of seeing that, of seeing the part of the person that has not been tainted by trauma, I think is positively the most beautiful piece. And so it's this honoring of the person that also then creates, it gets rid of the hierarchy, that I'm not the expert in the room, they're the expert in the room. I'm not the person that knows how to, what they need. I'm the person that is following and is maybe finding out some things that they're saying that they might not be aware of that they're saying, and that I can bring to light those pieces. So I think that that is the premise where we start from.
Yeah, and it seems like, I mean, as therapists, we strive for that without medicines assisting us, but it seems like it's much easier to get in the entanglement of like, is that happening, and trying to facilitate something, and chipping away slowly. And so, is it, from your perspective, like the MDMA can just speed that process way up, basically, of seeing and finding that inner innate intelligence, that it just creates more space for that to arise quicker?
I do. Sometimes I think that even though that voice is there and that part is there, it's a little bit like a murmur. Like sometimes it's so quiet that even the sound of being in your car can muffle it. And with MDMA, it really speaks really loud, and it's impossible to ignore. It's like it's right there, shows up, and we see it and they see it, and it's a felt sense, and it's like, oh, here it is. And it's not about getting rid of the ego, because I think we need the ego structure in order to go towards growth and towards healing. So it's not about like surpassing the ego and getting beyond it. It's more around how do I show up as my essential self. And so I do think MDMA, one of the beauties of MDMA is that it gives participants that gift. I am going to give you the gift of showing up in that way right now, maybe for the first time in your life.
Wow. I mean, to me, it's such a hopeful message for humanity that you've never seen this not show up.
Yes.
That it always comes.
It always has.
I feel very impacted by that.
Yeah.
It's a hard time in the world right now, and it feels amazing to hear that hopeful message.
Mm-hmm.
I'm curious about, you brought forward the idea of the ego, and it's not about going beyond the ego. And I wonder if you could describe in your own words how you think about the relationship between this inner healing intelligence and the ego.
Mm-hmm. Yeah, that's an interesting question. I think that, we need ego structure in order to learn from the insights that we have from the experience. And that then the ego can be in relationship with the inner healer, and can learn from it, and can put aside that sometimes the ego thinks that I need to we need certain things to monitor ourselves, right? Like I'm gonna critique you so that you can be on your toes and you can do the things that you need to do, right? Like it's almost like it's an impetus to move forward and what we need. And then it's the ego learning that that's not necessary, that we don't need to do it in this way of criticizing or judging or thinking that we can be better, or that it really does happen, that we don't just go to sleep if that's not the case. So there is, I think, a relationship between the two that maybe they've never met, that and how do we respond? Like how do I respond to my ego and my inner healer in the room, right? Like, and so if I'm not if I step out of the way and allow that relationship to grow, then there's a trust that gets built too, which I think is part of what we value as well, is that to trust that everything that is happening in the session is coming up for healing and is coming up for a reason, even if you don't understand it. So I think the ego has a really hard time with that, right? Like a lot of times in a session, we hear people say, like, I just feel like I'm not working. I came here to do this and specifically, and I'm not talking about that. And I'm having this really wonderful feeling, but that's not what I'm here to do. I'm here to work. I'm here to do this. And so it's really about the ego saying, oh, it's okay. You know, it's okay. And can we trust that this is here for a reason? You know, that I remember a participant having an experience. It was her very first session. And she just had almost like this love fest with herself. And she was just loving herself for the first time ever. And she just thought, what am I doing? What am I doing? I came here to do this other thing. And what am I doing? And even the therapists were kind of feeling a little bit like that. Like, should we mention the trauma? Like, what, you know, what do we do? And it was like trusting that and then realizing that she needed that her ego needed that to then allow for these other pieces to happen later on and to really address other pieces of it. So, so it's that trust piece too, right? And that it's about, like, I think consolidating rather than transcending. Consolidating with the ego rather than transcending the ego.
Yeah, it makes me wonder just your takeaways of like the stages of healing that happen, if there even are any stages, or if it's just sort of everyone's so unique. But are you kind of seeing, like, we could obviously talk about stages of healing and PTSD work in general, but I'm
Right.
curious with MDMA, if you sort of see overall some themes right now about how people go through different stages of healing with the MDMA.
Yeah. I think you're right. I mean, everybody has a very individualized way of showing up. But I have seen a little bit of a pattern in a lot of people, which is that you do start in that sort of younger self, that we start there and we start seeing what is there, what needs to be healed, what was the conditioning, that took me away from my essence, from my essential self. And then from there, and that understanding and bringing it forward and having awareness around it, then you're able to then move past that into other parts of the self until you get to the present moment. And what does that mean now? You know, who am I now? How do I move forward? So it's almost like chronological in a way, you know, I've seen that quite a bit. And I don't know if that's what you mean in terms of stages of healing, but that we need to heal that part first, which that says, to be able to understand, if I understand some parts of myself that don't have to do with trauma, how did that then informs how to work with trauma and how to begin to dismantle this piece that I think, I don't know if it obviously doesn't happen with everybody, but I see it in a lot of people where with PTSD, whereas I need to understand something about it. I need to make sense of the trauma. I need to have some questions answered. That's where I want to begin the healing. But that's not really where the healing is, because there is no answer, right? There's nothing that we can understand that we can really say, this is the answer of why that happened, why you had this horrible thing happen to you. And so then it's the realizing that that's not the ground to start from, that that's not the moral compass, right?
Yeah, I think that's such an important piece of looking for answers in the wrong place. You know,
Yes.
the way that we use the cognitive mind or the thinking mind to look for solutions or answers to trauma when the deeper reconnecting between different parts of the self is such a mysterious and somatic, oftentimes very somatic process that oftentimes isn't really that cognitive at all.
Yes.
And I think it also speaks to how MDMA works more in a somatic framework and not so much in a cognitive framework. So I wonder if we could go a little deeper into the concept of different aspects of the self relating with each other and this kind of parts work perspective.
Yes. Yeah. And, I think parts work, like, I tell therapists when we train them, you don't have to be an IFS therapist to do parts work. Parts is what we all have and we've all used and we've all been, I think we've all said, oh, a part of me really wanted to go to that party and a part of me didn't want to go, right? Like we've all used that kind of language. We all understand ourselves as different parts if we actually really look at it, right? And so I think what happens with MDMA is that the parts come up just like the way that healing intelligence comes up, parts come up too, because then there's an opening and it welcomes all the parts, right? So it welcomes all the pieces that form that whole that hasn't been whole because it's been so fragmented. And so the wonderful thing I think about parts is realizing that it's not all of me. It's not all of me that has felt this incredible pain and suffering. It's not all of me. And just by doing that, then you get a little bit away from that identifying with the trauma self, right? That I'm just this traumatized person. And then it's like, well, there is a part of you that is this traumatized person. And who else is here, right? And it can even be here, the person that is connecting with me, the therapist. Who is this part that is connecting with me? And how do I as a therapist talk to that part depending on how old they are? That my responsibility is also, how do I relate to this part? If it's a 3-year-old, I can't talk to her like, a 25-year-old, for instance. So parts are just such a natural piece of the human being that I think MDMA allows for that too. Of what is it that human beings are made up of? And it's parts and ego and this healing intelligence, and it's so much more richer. It's so much richer than we think it is. That we think is like, this is who I am. This is a person. This is my identity. This is. It's just so much. It's almost like we're missing half the picture when we see it that way.
Yeah. Well, maybe it would be good to also just break down a little the aspects, the modalities that seem to be working really well with, an MDMA assisted psychotherapy session. Like, what are the modalities that seem to be working very well? Are there some things that are tried that just seem to flop? It didn't work out that well.
There are some things that don't work very well sometimes.
I think Marcela has a video in her training of me doing things that didn't work so well.
Yeah.
I have a little clip that is called Bruce Rolls His Eyes. Where my co-therapist is just like rolling his eyes at me, like, well. I think I'll talk about the things that work well first. And so we call it inner directed, right? And it's a little bit about what I talked about before, which is a sense of, I'm not, as a therapist, I'm not introducing something into the room. I am maybe addressing things and making connections of what has already been sort of what is presented into the room by the participants. So is this, it's not, it's not a philosophical stance. It's more of an attitude of bringing forth that can I trust what is happening in the room? So not like a technique, something that I'm trying to get to, but how do we stay with that, even when it's maybe really painful, when we see somebody in a lot of pain, and how do we say, this is what needs to be here, and how can we support this happening? So I think that that's also one of the pieces that we do, is really trusting that, and constantly coming back to the present moment, constantly saying, it's a organized ignorance. It's like, how do I come to the room, leaving aside what I think I know, to be in this very present moment and keep bringing the participant back to this present moment of where we are. And you mentioned about the body, and it's usually done through the body, right? What is it that you're feeling right now in your body? And in order to answer that question, I have to be in the present moment. So it's coming back. It's very body centered and very client centered, and it is about the experience that is happening right now. Even if the parts that are happening are something that is remembered, it is about what is happening right now. So then that also gives a sense of validation that, oh, I shouldn't be feeling this way because this happened 20 years ago. Why am I still feeling this way? It's like, this is what you're feeling right now, right? So can we stay with that? And so I think that works, working somatically, working with the parts, working with inner directed, having times when people go inside and times when you relate with them. And that it's really when they're inside and not talking to somebody that they get the insights that come from their frontal lobe, that it's really that connection of, I am making all these connections that I had never made before. And that feels so incredibly inspiring, right? That's inspiring, that to have all these connections. And so it's holding the connections, being able to be with themselves and be in relationship. And it's almost like it's creating a culture in the room. The two therapists and the participant together are just creating this culture that that is based on love and acceptance and respect, for each other. So I think, like in terms of the setting, how important that is to really bring in as much as we can a way that is inclusive, that includes all cultures, that we're not decorating or doing things that is just one culture and there's somebody's going to feel left out, that is really paying attention to what we bring in, and knowing that every detail matters, right? Every detail. This is your time. This is your time that you're here with us and we're here for you, which is something that a lot of people don't get and don't have. People don't have 8 hours for themselves, but let alone people don't have 8 hours where two people are there for them. And the sacredness of that, right? That's so sacred. So it's honoring that piece, and knowing that whatever is happening in that room, there's an energetic field around it that everybody's feeling, that even though the therapists aren't taking MDMA, they feel it, right? They feel it. There's an energetic, I always feel when the medicine is coming on. I can tell, and like a second later, they say, oh, I feel something, so they're so open that it allows me to be open, and it allows me, when people say, why do you love doing this work? Part of it is that it allows me to be unself-conscious, which I'm hardly ever.
Yeah.
Yeah. Yeah, that's beautiful. I'm curious if is the healing ever cognitive and like retelling the story? Do people ever go through just needing to retell the story as part of their healing during the MDMA session?
Mm-hmm. I think it's being able to trust that if they are telling it, that you would know when it does become, like if it ever became, oh, this is maybe an avoidance of something and they're just telling the story, and how do I check that out? But also then not to start there, that you might get to that place and you might get, oh, this person is really, they're somehow in a loop and their story becomes part of their loop. That's up to us as therapists to know that and to question that, but to really start from a place of there's a part of them that needs to tell this story right now, and can I listen to that story, and can I respond and be here without judgment, and follow that. And so many times what I've seen is, oh, sometimes we tell people if they've told their story quite a bit, and we say, like, let's try maybe to go inside for a little while and see what happens. And sometimes there's a reluctance to do that. And then if you really honor their story and honor that they can tell it to you, then there's more of a trust that can be developed in terms of them going inside. And that sometimes it is that they were always told not to tell the story, right? And so how incredibly valuable it is for somebody who has been told you can't tell to be able to tell. And so as a therapist, to honor that too, right? That if I tell them not to tell me, I'm doing the same thing that they were told to do. And so sometimes telling that story is incredibly healing. It's out in the open. It's sort of like what happens with shame, right? Shame means there's a secret, and how do we bring it out and be able to share it and get some of that unburden that piece.
It's a lovely way to talk about checking your assumptions at the door in that example, where the one person might be in a kind of very disembodied way, just retelling the narrative as an avoidance, whereas another person might be really critical for their healing, for the therapist to embrace that and meet that with warmth and receiving and care.
Yeah. How do we, I think that's really difficult for clinicians, for all of us to do. Like, at some point, we have that agenda and we have those stories that we think are going to help, right? Like, or we know this is avoidance, or we know this is this, or we know this is that. And how do we trust ourselves to know that it's okay to leave that outside the room, and that it'll be there if we need it, right? That those tools, that toolbox that we have, it'll be there. It doesn't go away. And we do use it when we need it. But how do we have that, that beginner's mind? It's so difficult to do. And I realized that in an 8-hour session, we get tired. And when you start getting tired, whatever it is that is difficult for you to do about being present comes in. And like for me, it is beginner's mind. Mm-hmm. I have a difficult time when I'm tired to have a beginner's mind and to really come to it clear. And then I find myself start making these assumptions, right? And then I have to check myself. Hold on, I'm just tired. I need to step back and hopefully bring compassion to my awareness. Sometimes not so well, but it's definitely my intention.
Well, that's one of the things that I think is so interesting about having two therapists in the room, because I remember on a number of occasions with you as a co-therapist with you, checking out one of these assumptions, like, with a quick little note on the notepad, is this avoidance ? And then, you might be able to sort of co-regulate me in a way, or, relax,
Right.
that I think this is actually really necessary and important. Let's trust this. It's very different from having to make that judgment call as an individual therapist.
Yes. Yes. And it's also, you bring up a really beautiful piece about co-therapy, which is that helps with that piece of not thinking I know better, which is if I have a story in my head of where I want to go with this particular thing, and then you as my co-therapist bring in something first, and I follow that can lead into this beautiful place, right? That was so different from where I was thinking, that it's a very humbling experience of being able to say, oh, there's just not one way, right? And we can be open to these other ways of working, and we can support each other as co-therapists. And so I find that it's a really humbling experience, and in following what my co-therapist and trusting them, but also in what you said, which is checking things out. So I'm not the only one making this decision in the room, and I'm not the only one thinking this. And how wonderful that feels, right? If you pass me a note and it's like I just go, yes, I was thinking the same thing too. It's just so validating to have that other person validate that. Yeah.
Yeah, and you also seem to like what's really interesting to me is like what the differences are as the role of the therapist between, if we just call it for the moment, psychedelic assisted therapy and non-psychedelic assisted therapies. There's obviously similarities as that it's therapy, but there also seems to be, like you're pointing out, there's some differences here about the position the therapist takes when there's this extra helper online with this medicine. I wonder if you could just kind of tease that out a little of like, because you've obviously, like, what's the difference you see is between the medicine's there and when we don't get to use that medicine to help people?
Well, the beauty of the medicine is that you can drop in very fast. So almost like all the pieces that in a non-psychedelic therapy, to get to that dropping in can take a really long time and can take many sessions and back and forth. And the next time they come in, you have to take another step back because you're no longer there in that spot. So there's a difference between seeing someone for an hour and a half, and seeing somebody for 8 hours. So that's in itself a big difference. But with MDMA is that you do drop in. And by dropping in, I mean to that place where you have an intimate connection with self. I'm intimately connected right now, right? And there's all these possibilities that come out from that. And it's such resource rich. I have all these resources. I can titrate myself. Like the therapist doesn't have to titrate me. I know how far I can go. And like, oh, wait a second. Yes, I can push myself further. Oh, I need to take a break. And I need to just settle in and just maybe listen to music. So there's this resource rich area that happens. And then there's the dropping into this intimacy. And that's not just for the participant. There's also the intimacy between the therapist and the participant of, we're here from this place of non-judgment, right? Like we're here together in this connection that is happening. And so it's something that takes such a long time to do without it, if it ever happens. to really drop in that particular way, and to also, as a therapist, to be witness of that dropping in. That maybe we see it. If I think about my private practice, I have little moments of it, right? Little inklings of it, of dropping in, and it's like, yes, there you are. And they're wonderful, and they accumulate, and healing takes place for sure. But to see it in the moment, in this very moment in front of my eyes, I see you dropping in, and I say, oh, the medicine is doing its work. So it's in this work, we say trust the medicine, and we also say don't get ahead of the medicine. Don't think that you need to get somewhere with it. The medicine asks you to sit back and to trust it and to trust its pace. And you have the time to do that, where it's much more difficult to do in an hour and a half session, an hour session.
Yeah, the follow-up for me here is when I think about non-psychedelic assisted therapy, at least a lot of the somatic training that I've been through, there's a lot around trying to track presence in the therapist as well as in the client, right? And seeing if, for instance, do we believe the client is, what degree of presence is going on right now for healing to occur? Yes. That sort of, there's a premise that healing can occur in a state of presence more than in a state of, let's say, dissociation as the opposite. I'm just curious, like from the psychedelic assisted therapy perspective, when you say drop in, is it just like there's just more presence naturally, or you're still tracking presence and dissociation? And
well, it's interesting about dissociation, because dissociation can come in and can be part of the session, but there's presence in the dissociation. So I think is that you don't need to track it in the same way. It is self-manifesting by nature, because it's so relational. The participant is also tracking the therapist, right? They're way more aware of, if you're stressed, they're going to pick up on that stress. If you're distracted, they're going to pick up on that distraction, right? So you as a therapist have to be so present with that, knowing that they're tracking you as well. And in that tracking is where they find brave space, and where they find safety, and where they find trust in themselves, right? So I think there's less of a tracking of it and more of a noticing when it's really not there. It's very obvious. It's very obvious when you're not being present. And how do we return to that present moment experience? So it's much easier to do because it's so obvious when it's not there. So like when we work with dissociation, it's a very different way of working with dissociation, because there is a presence to it that generally doesn't happen with dissociation, so that you're able to then explore it further. What is the dissociation? What is happening there? Because it's happening in the present moment, and I can see it from that point of view. Does that make sense?
Yeah,
that makes a lot of sense. And I'm assuming too, like, and different medicines are different. Like we're talking about MDMA, and there's ketamine and psilocybin, but I'm assuming too that you could speak to this too, that with MDMA there's maybe less of these incredible states of overwhelm that can happen in trauma work, where it's just a flooding and trying to get people to just calm down. Or is that not true? Do we see that level of overwhelmed states on MDMA where we're just trying to help people resource to downregulate?
So we do see overwhelm happening, but I'm not sure if I would call it overwhelm. And it's more that because there's so much resource happening in the person, then they're not out of control, and they don't feel like they're out of control, which I think is when we need to then help regulate and find resources for them to regulate, right? There is no need to regulate it. because there is an understanding of my body can actually handle this. My body has so many resources right now that it can move through it. So if you imagine that you have you're in a state of what looks like overwhelm, somebody who is just really activated and having tremendous pain and is just really suffering. But at the same time that they're doing that, they have a part of them that feels a total sense of well-being, a belief that this is where I need to be. I belong in this body. I belong in this experience. I feel this bonding with myself, with the world, with my therapists. There's a sense of ease in the body, of like relaxation in the body. So imagine that you feel that at the same time as this overwhelm, if you will. Then it doesn't become overwhelming. Then it's
Right.
I can work with this. This has a purpose. This has a reason to be. And how do we support it so we can move through it?
Yeah. It's sort of like what you were saying before about inside the dissociation, there's presence, or with the dissociation, there's also presence. And when these two things, it's sort of like the MDMA. I remember hearing a number of participants say things like, it gave me an ability to see over the trees, or a perspective that
Yes.
and that kind of metaphor to me is a way of describing this level of contact with inner resources, while you have also a deep contact and awareness with the wounding or the dissociation.
Yeah.
Which
Yeah.
I think is a way of describing a resilient state, where you have a very high level of challenge and a high level of resource in your system at the same time.
Yes, I like the way you're saying, and I think that that's really that describes it really well. That it's, if you think about a window of tolerance, I don't think there is a window of tolerance because with MDMA work, because when you go past that window, you can still work. When in either direction, if you start numbing out, if you start activating, you can, that numbing, like what is that part of you that is numbing? And let's explore that part. Or what is the part of you that is feeling this activation, right? So it's sort of, it breaks apart that idea of working within the window of tolerance. I think it just, it doesn't, I don't think it works. I don't think that model works with this, with MDMA work, because there is not a fine line.
Right. And it sounds like too, the organizing self, if we look at parts work or IFS, like the self can come online more, even in these states where there's a lot of expression and sensation in the body. Yeah. The self can come online more when sometimes without the medicine, it's, we see that these heightened states of activation in the body, the self really can go away and they can't show up in the space.
Yeah. Yeah.
Without turning the volume down on the expression of the activation.
Exactly. And so, what I was saying earlier in terms of like, there's a self-titration that happens so that the therapist doesn't have to do that. The therapist doesn't have to put a stop to it because something is happening that is going to harm the person, right? Because there's so much, because they feel so much resilience and resource, they know where they can go, and they know how far they can go. And I haven't seen anybody who hasn't done that in an MDMA session where they haven't just gone, okay, whoa, like that was intense, or even the fear of it, right? Like, this is really intense. This is like powerful. I don't know if I can work with this, and then work with it.
It's like a function that in ordinary therapy, the therapist has to sometimes step in or provide, or
Yeah.
or help turn down the volume, that titration function is actually can happen internally with the resource of the medicine.
Yeah. Yeah.
And there's a lot, I feel like, in my limited experience, just so much trust that you can have as a therapist when you begin to have those experiences and you watch people be able to do that on their own.
Absolutely, absolutely. It's the trusting that presence is guiding the way, right? Is shining the light on wherever it is that they need to go, and so we can, I think in a way that's what I mean by not being self-conscious in a session, because there is no conscious self of me that needs to be present, right? Like I'm here to step into somebody else's point of reference, into somebody else's life, and guide myself in there, or like not guide, but understand them from that place of their point of reference, not my own, and so I can leave mine.
Yes.
Which I think sometimes in therapy without MDMA, I'm not able to do that.
Yeah. Well, we're wrapping up soon, but I'm curious, one more question for a few minutes here before we wrap up. I believe you've done ketamine-assisted psychotherapy. Is that correct?
Yes.
Okay. So I'm curious about your take on the differences here. And if we're really looking at trauma for the moment, we have a clinic providing ketamine-assisted psychotherapy, and predominantly we see it used for depression in our clinic, but we do see results for PTSD. I'm just curious about the differences that you're picking up on in terms of these medicines. And obviously ketamine right now is the one that is not in the clinical trial that we can actually use. And so I'm just curious what you're seeing here between the two medicines.
Mm-hmm. They're such different medicines, and the part that they have that is the same is the softening part of the self. And I think that they approach it from different doors. So I think with MDMA, I don't know if this is going to work, this analogy, but with MDMA, it's like I get at things from the front door. I come in the front door and I see what's there and I explore it and I'm moving towards the back. And with ketamine, it's almost like coming in from a different place, almost like fooling the self to come in from this different angle to explore the exact same thing. So instead of diving in, it's more a moving out to see what's there with the ketamine, I think. So I see that as the difference, that one of them is more, and they're both needed, I think. They're both, my ultimate goal would be to use ketamine as preparation for MDMA and as integration for MDMA. That I think that they would make great bookends in terms of observing and working at trauma from these different angles, from these different perspectives, from these different different parts of the self, right? Like this different non-ordinary states, that they each provide a very different non-ordinary state, and they're both needed.
Thanks, Marcela.
That was a great explanation. Well, we end with everyone the same. We haven't given you this question, so you'll have to come up with an answer if you want to. So basically, we ask every guest this question, which is that if there was a billboard that you could put a paragraph on that every human being would see once in their lifetime, what would you want to tell people?
I'm trying to do something without it being a cliche. That's really hard with that question. I think that we want that. Can we move towards having the presence of something rather than the absence of something? Can we approach ourselves and our growth from the presence of something that is there, that is loving and kind and compassionate, and not from the absence of something that we need to get rid of?
That wasn't cliche. that was great. Thank you.
Very profound. Thank you, Mars.
Thank you. Well, thanks so much for being on the show.
Thank you for having me. It's always a pleasure, and what an honor. Thank you so much for the opportunity.